Good day, everyone. I am Justa Encarnacion. Everyone knows me as Tita, Commissioner of Health, and welcome to you. You are joining us today on episode 9 of the Press Box. Today, we're taking a closer look at COVID and COVID vaccines, developed to help lower the transmission of COVID and the illnesses that may follow. For those of you who have not yet made the choice to be vaccinated, it's very important that you all have the facts to make an educated decision. We are here to provide you just that, the scientific explanations. Joining me today for this conversation are members of my team, our territorial epidemiologist, Dr. Esther Ellis, and Chief Medical Officer, Dr. Taihan Caesar. We also have invited physicians who are on the front lines of the pandemic in our local hospitals. Dr. Louis Amaro, we're hoping to be able to hear from him, the interim CEO of Schneider Regional Medical Center, along with Dr. Clayton Whitley, who directs the emergency department at SRMC. Also have with us our critical care physician or intensivist at the Governor Wang F. Louis Hospital Medical Center, Dr. Shores. Welcome and thank you for taking the time off from your busy schedules to join me here today for this critical conversation. Before we begin, let's go to Dr. Esther Ellis, who's going to tell you a little bit about what's going on with our COVID numbers today.
Good evening. Thank you for having me tonight on the Press Box. Unfortunately, our COVID numbers are looking the worst that they've ever looked since we've had COVID in the territory. Yesterday, there were 76 new positives in the territory, and we tested 774 individuals. Most of our positives are among 30 to 49-year-olds at this point, and we currently have 351 active cases. Our 7-day percent positivity, so that means out of everybody that we test, what percent test positive, is 5.52%. And we really do need to keep that number under 5% to have contact tracing be effective and control in the community be more effective. On St. Croix, we currently have 122 active cases. On St. Thomas, 216 active cases. And on St. John, 13 active cases.
Thank you for that. Let's speak about our hospitalizations a little bit. Dr. Shores, can you tell us how many people do we have hospitalized at this point in time?
At Juan Louis, we have, I think, 18 inpatients, although I haven't been, I go back to work tomorrow after a few days off, so I haven't looked at the numbers in a couple of days. But we have 4 people in my ICU on ventilators. And those are the most critically ill people in the territory with COVID. And one of the things I think is important for people when they think about ventilation in COVID patients is they stay on the ventilators for a long time, a lot more than other illnesses. Many people are on the ventilator for 2, 4, 6 weeks at a time. It's an enormous strain on a person's body to be just in bed for that long, much less with a machine breathing for them. So it's something that I think everyone should strive to avoid. And we'll talk about how you can do that today.
Thank you. And I know St. Thomas actually has 20 admissions right now, and 5 of them are vented. We had earlier this week 2 pediatric admissions at RLS, and we also had, and we've been trending this as well, to seeing individuals coming in, pregnant women that are positive. So have you been seeing a lot of that at JFL as
Absolutely,
well?
absolutely. We've admitted, I think, 5 or 6 pregnant women, and I think early in the pandemic, one of our deaths was a woman from St. Thomas who was pregnant. So pregnant women, we'll talk some about it during the show, but they are at higher risk for many kinds of infectious diseases. And by higher risk, I mean worse outcomes, both maternal and with the babies with COVID-19.
Okay, and I know we're going to get into vaccinations before, but since we're on this topic, I want to ask, are pregnant women, is it contraindicated for pregnant women to get the vaccine?
Absolutely not. Many pregnant women all over the world have been vaccinated. They were not specifically included in the clinical trials for the vaccines, but they were allowed. And then since then, there's been many studies where they followed longitudinally women after they were vaccinated, either trying to get pregnant, or postpartum and breastfeeding. And there's been no adverse events, serious adverse events in women that are pregnant that have gotten the vaccine. And we probably have saved many lives, both moms and babies, by doing this.
I think that's impressive, actually, especially since we've actually been seeing so many here within the territory. Now, looking at our COVID numbers, our vaccination numbers, do you have a record of what we've done thus far in vaccines?
I can pull that up for later in the show, definitely the vaccination
Yeah, please.
numbers.
I think that would actually be helpful for us to be able to have that available for the viewing audience.
Okay.
So that would be great. Now, of course, we also always speak about our heroes at the hospitals and healthcare providers throughout the territory. And so, of course, the governor had the educational, the lottery. I don't play the lottery.
Yeah.
Maybe that's the I'm subbing over the word, but I have to start to play it a little bit more. But the education lottery that was completed now, the Healthcare Hero Special Drawing to thank all the hardworking healthcare professionals, including you. You have an opportunity, working with both of you actually have an opportunity through this pandemic. Must be in healthcare or health-related field or an allied health professional, a VI resident and fully vaccinated. Deadline to be fully vaccinated is October 1st. Drawing is October 4th. Winners will be announced on October 12th. Now, I think that's absolutely wonderful that we're looking at that. And Dr. Ellis, did you find the numbers for us? Could you give us a rundown of how many people have actually been vaccinated throughout the territory?
Yes. So we currently have just over 46,000 individuals vaccinated. So let me get you the exact number. And so we have under 50% of our population is fully vaccinated. We're one of the lowest, we have one of the lowest vaccination rates out of all states and territories right now. And we also have one of the highest new infections of COVID per day compared per 100,000 people compared to other locations. So, let's compare us right now to a state that has a very high vaccination rate. So Maine has one of the highest vaccination rates in the state right now, and they have one of the lowest new infections per 100,000 compared to other states and territories. So at this point, they have 11 new infections per 100,000. As you saw today from our numbers, we had 76 just today, but our average new infections per 100,000 per week is 47 right now.
Okay. That's a little bit on the scary side. I wouldn't even say, it's just really, truly on the scary side. One of the things that I've always thought about is really trying to explain to the general public, what is the virus? How does a virus actually replicate? And what does a virus feed on to replicate, to change into other forms of that same virus? Can you tell the general public a little bit about that?
Yeah, and apologies for not having the exact number. It's 46,672. And as you know, that number changes every day. And so I look forward to that number increasing. We have seen a slight increase over the past month as individuals have seen family members be hospitalized or unfortunately family members that have passed away. But viruses replicate in your body very easily. And viruses mutate. The more individuals that they infect, the more opportunity for the virus to mutate. And they mutate to make them stronger, the virus. And so a virus mutating to make itself more contagious is part of evolution. The strong survive. And so we have, and that's why we have the Delta strain. And so, circling back to how that ties into the vaccine, the more individuals that are unvaccinated, the more opportunity for the virus to infect more people and continue to mutate.
Dr. Shores, and you've actually seen so many individuals. I know you've been here for 2 years, so you've actually seen what's going on within Wanganui Hospital and Medical Center, but you've heard about what's going on before, outside of the territory. And what have you heard recently in terms of hospitalizations, number of hospitalizations that we're seeing nationwide?
Well, it's In states that have low vaccination rates, the numbers have gone up tremendously. I trained at UF Jacksonville, did my ICU fellowship there not that long ago, and I am Facebook friends with many of the nurses and doctors there, and they are just devastated. They have more admissions now than they've ever had. The hospital is once again shut down. It's elective surgery cases, and you know that's huge. You know, your heart surgery really isn't elective. You know, to get your valve replaced, and people die on waiting lists when they're waiting for their elective surgery. It also means that their ERs are full, and people wait much longer. And so what we saw at the beginning of this pandemic, we will see again, is that the death rate in this country go up for all kinds of diseases when our hospitals are so full of people with COVID, because all of the resources are going to the COVID patients, and the guy with chest pain kind of stays home, doesn't want to go in, a little afraid of COVID.
Or afraid to go in.
And they're afraid to go in, or they wait in the waiting room too long, or the nurse that's in the cardiology suite is out with COVID. I mean, there's a ripple effect when so many hospitals are surging with COVID. There's also a psychological effect, and we all know this. My youngest sister has gone to Jazz Fest in New Orleans every year for almost 30 years. And she called me up this week and was so excited that they were going. But guess what happened 2 days ago? Canceled again. Just like Jump Up, just like Carnival, just like everything that we want to do as a society, you know, to maintain our relationships and to have fun. And so we're all weary of it. We're weary of being at home.
The last episode of the Press Box, we spoke about chronic disease and really and truly looking at cancer as being one of the chronic disease, and why really and truly, like you said, right now our chronic disease population is being ignored somewhat because we are focused so much on COVID. So I think we actually have a lot more to speak about, so we're going to go ahead and take a little break and be right back.
Right.
Thank you both.
Hands up, be vaccinated and proud. So get the vaccine now, so we can gather with our friends and family together, so we can start back school and full the classroom, so all the kids them will learn better. Get the vaccine now. There's only one way for us to create a herd immunity in the United States Virgin Islands. Get your vaccine. Starting July 9th, the United States Virgin Islands government is giving away $100,000 every week for 10 weeks. Only Virgin Islands residents who are fully vaccinated against COVID-19 are eligible. If you've only got part of the vaccine, you can also win $50,000. Take your best shot. Let's put the community first and win big. Vaccinate yourself, here we go.
Okay, great. Thank you.
Hey, you.
Hey, babe. Thanks for lunch.
You're welcome. Who is that?
That was a representative from the Virgin Islands Department of Health. They're doing a survey called BRFSS.
Oh, for what?
It's to address chronic diseases facing the Virgin Islands. Diabetes, heart and kidney disease, cancer, stroke, and more.
What kind of questions do they ask?
They ask questions about food, exercise, age, smoking, and some others.
Is that all they ask? Do they ask questions about...
Security? No. They don't ask anything about Social Security, money, or credit card information. The information that they do collect is used to guide public health programs that affect all of us. You, me, the kids, the community, and the entire Virgin Islands.
Oh, okay. Very interesting. I'm glad we could do our part to help.
Yes, we've got to do our part.
For more information, visit our website or call John Orr at 340-643-5422.
Hey students, this is Governor Albert Bryan Jr. One of my favorite things to do is read. A good story can fuel the imagination and introduce you to places and characters you've never seen or heard of before. This summer, I'm reading 5 books, and I'm challenging students in grades K through 6 to do the exact same thing. Take my summer reading challenge and read 5 books. Choose from the books you have at home or log on to read5.org for a super selection of books you can download for free. Keep track of all the books you've read and submit the tracking sheet online at read5.org or when you return to school. My summer reading challenge ends on September 3rd, 2021. Read 5 or more, you meet the challenge, and you get invited to my big celebration. Stay safe, be good, and read 5.
back to episode 9 of the Press Box. Again, here with me, Dr. Shores from Wang Louis Hospital and Dr. Ellis, our territorial epidemiologist. We also have Dr. Wheatley, who runs the emergency department at the Royal Leicester Hospital and Medical Center. So you'll be hearing from him as well later on in the show. And one of the things that we hear is to really and truly speak about some of the things that we're hearing. And what I'd like to do is start by talking about, we've had some protests, individuals who are concerned, really want to have some more information about the vaccines themselves. Maybe are a little reluctant. We see some hesitancy for receiving the vaccine. And I think that we appreciate everyone's individual's rights and responsibilities. But earlier we spoke a little bit about what a vaccine actually is and why it's so important for us to stop this, how important it is for us to stop the virus, what a virus is, and why should we actually put all efforts that we can to stop the virus from further duplicating. So right now there's some things that I'd like you to clear up for us and for the general public. And viruses are not new, true? How many hundreds of years? Okay. COVID-19 will disappear on its own like any other virus has done in the past. Dr. Shores, I'll give you that one.
Well, smallpox disappeared. Smallpox was here for centuries. I mean, you can find evidence of Egyptians suffering from smallpox before the birth of Christ, and they didn't disappear until we had a vaccine. Many viruses have disappeared in our lifetimes, or essentially, chicken pox is rare now among kids. When, I had chicken pox, so did my kids. But measles, mumps, rubella, tetanus, the list goes on. Yeah, those viruses and bacteria have disappeared, but it's because of the vaccines that we use to get rid of those deadly diseases. If you look at our grandmothers' times, they would have 7, 8, 9, 10 kids, and half of them would die before the age of 5. A third of them die before the age of 5 of childhood diseases. And we have eliminated that. And I think so much of our population, we've lived without it now for generations, without those diseases, that we just don't remember as a society how terrible viral diseases can be.
Thank you. Now, some people say that, well, you hear different things. You hear, I will take the vaccine if there's a live vaccine. Some people say that. Some people say they don't want the vaccine because there is a live virus in the vaccine. So you hear both. So let's talk about the vaccines that we have available. What are the types of vaccines that we have available, and what are the components of those vaccines? Dr. Ellis.
Yeah, so we have 3 vaccines available in the U.S. and territories, and I'll talk about the first 2, Pfizer and Moderna. They use what's called mRNA technology, and it's mRNA designed against the spike protein of the virus that the virus uses to enter cells and make people sick. So the other vaccine that we have is the Johnson & Johnson, and that uses an adenovirus vector to get the vaccine into your body and to target the right cells. That's the same technology that's used in the flu vaccine. The flu also uses an adenovirus vector. And other than that, there's some sugar, there's some preservative, and it's very simple, the ingredients.
So is the Johnson & Johnson considered a vaccine that has the live virus in it?
No, none of the COVID-19 vaccines have live virus.
Is the Johnson & Johnson closest to that?
It's probably the closest to, because the flu, some of the flu vaccines are live virus, and some of the flu vaccines also don't use live virus, but they all use the adenovirus technology.
Okay, so having the Johnson & Johnson the way that it is developed at this point in time, it's not different, it's not unusual for that to occur in terms of the flu virus.
Right.
Okay, good. So thank you for that. Dr. Whitley, can you hear me, sir? So happy to have you on the show. Tell us a little bit about what's going on in your emergency room. I know that your hospital is pretty full.
The hospital at this point, and the emergency room in particular, are busting at the seams. Yesterday, there were 6 patients that were admitted. There were 3 in their 40s, and there were 2 in the 60s and 70s. The emergency department at this time is seeing so many positive cases of COVID most of which are not admitted, not sick enough to be admitted, but it also takes up resources and rooms that, as Dr. Ellis mentioned before, Dr. Shores mentioned before, we cannot see other critically ill patients who are still coming in large numbers. So it is a ripple effect. And if we could just get a larger number of our population vaccinated, that would solve so many problems.
Now, what about those who actually have been, who did contract the virus? Some of them say, well, I had COVID, so I don't need the vaccine. What are your thoughts on that?
No, absolutely false. Because you had the virus does not protect you from passing on some of the strains, some of the Delta variants, and some of the other variants that are present in the community. So the fact that you've had COVID really is not a reason not to get vaccinated.
See, what I tell people, Dr. Wheatley, is the Delta virus has caused us to go all the way back to the beginning. It has nothing like the Alpha. And so what individuals saw with the Alpha, being able to, yes, contract the virus, and then they get over it, and then they're okay for a while. The Delta virus now attacks you in a completely different way. What are the differences that you're seeing in the emergency room? And Dr. Shores, I'll ask you the same thing for ICU, but what are the differences that you're seeing in the emergency room with patients who contracted the lesser severe form of the COVID-19 and now the Delta virus, the variant?
The Delta is a totally different animal. The ways in which people are getting it and have no idea where they were exposed, it just goes to show you how much higher of an infectivity rate the Delta virus produces. There are patients that come into the emergency department each and every day that have no clue how they were exposed to the virus. You ask them if there have been any ill contacts, and no, they shake their head. They have no clue. Again, the Delta is a totally different virus compared to the Alpha and the Beta's, the UK variant that we had seen months ago.
I'm going to shift to Dr. Ellis before I speak to you, Dr. Shores, just so that you can look at the data for a second. What are we looking at in terms of how the virus is being contracted from one person to the next? Like Dr. Wheatley is saying, many of the patients that he treats don't know exactly how they're contracting the virus.
Yeah.
What are our numbers showing us?
So what you're speaking of is called community transmission, and so that's where we have no idea where the person got it from. And so far in the territory, out of our 5,169 positive tests, the majority have been close contact, 2,430, followed by community transmission. And so these are individuals that have no idea where they got it from, just they picked it up somewhere in the community. That's 1,502. And then the next is travel, 209, followed by under investigation, and that's 614. And so if you remember, part of the reason for that high number under investigation is we have 351 active cases right now. So we are working very hard to investigate them as quickly as possible, and then 414 unknown.
Thank you. Now, Dr. Shores, I would like you to continue the conversation that we're having with Dr. Wheatley, but then at the end, I want you to tell us whether or not those could have been prevented and how they could be prevented.
I will say we have seen a lot of community spread, but the other thing I've seen with the Delta virus is that I hear people say, oh, the whole family has COVID. Like the grandparents, the people 30 and 40 and their teenage kids and the little ones. And so we have seen both early in the pandemic and now later, members of the same family. We have members of the same family in our ICU now. And that's really scary. Then we also see a lot of younger people. And you have to balance that. We really struggled and worked hard to vaccinate people that were at risk when we identified people above the age of 65. But our vaccination rate in the islands here are not that high above 65, just like they aren't in all ages. But what I'm seeing is young people, people in their 30s and 40s, in their prime of life, put to bed, put on a ventilator for a month. They get tracheostomies, they get feeding tubes, they get pneumonia because they're on the ventilator for a long time, and as much as we try, the bacteria in their mouth and their gut can infect them, and they die from it. And they die, and it's such a heartbreaking thing for all people that work in the ICU, because we're trying to, not that long ago, we were literally working to save someone's life and had the phone up because the family wanted to FaceTime to see their family member for the last time. And we didn't have a good connection in the hospital at the time, And so that is so different from how I've ever practiced medicine before. We've had families in the room all the time for years. I love having families incorporated into the care of patients. It's better for the patients, it's better for the families. But with this infectious disease, we can't. And that, I think, is the hardest thing for me personally dealing with this, is that I can't have the families with their loved ones. And so it's that's on top of many other things with the Delta variant, how fast it goes through a community and how many members of the same family are sick.
I see that a lot as well. I have to tell you that personally, I've had a family member who came back from the mainland, did contract the virus, but then the entire family has been affected as well. And that's heartbreaking to be able to not be able to do that much for them. We're going to take a brief break, and when we come back, I'd like to speak about what's going on right now at both hospitals in terms of the vaccine mandate, talking about the vaccine and it not being fully certified by the FDA and the impact on that. Thank you. Be right back.
Vaccinate yourself, like we go. If you from the VI and you want to get vaccinated, put your hands up high. The life you save might be your own. If you from the vaccinated, put your hands up high. Be vaccinated and proud. So get the vaccine now, so we can gather with our friends and family together, so we can start back school and full the classroom, so all the kids them will learn better. Get the vaccine now. There's only one way for us to create a herd immunity in the United States Virgin Islands. Get your vaccine. Starting July 9th, the United States Virgin Islands government is giving away $100,000 every week for 10 weeks. Only Virgin Islands residents who are fully vaccinated against COVID-19 are eligible. If you've only got part of the vaccine, you can also win $50,000. Take your best shot. Let's put the community first and win big. Vaccinate yourself, like we go.
Okay, great. Thank you.
Hey, you.
Hey, babe. Thanks for lunch.
You're welcome. Who was that?
That was a representative from the Virgin Islands Department of Health. They're doing a survey called BRFSS.
Oh, for what?
It's to address chronic diseases facing the Virgin Islands. Diabetes, heart and kidney disease, cancer, stroke, and more.
What kind of questions do they ask?
They ask questions about food, exercise, age, smoking, and some others.
Is that all they ask? Do they ask questions about
Security? No. They don't ask anything about Social Security, money, or credit card information. The information that they do collect is used to guide public health programs that affect all of us. You, me, the kids, the community, and the entire Virgin Islands.
Oh, okay, very interesting. I'm glad we could do our part to help.
Yes, we've got to do our part.
For more information, visit our website or call John Orr at 340-643-5422.
Hey students, this is Governor Albert Bryan Jr. One of my favorite things to do is read. A good story can fuel the imagination and introduce you to places and characters you've never seen or heard of before. This summer, I'm reading 5 books, and I'm challenging students in grades K through 6 to do the exact same thing. Take my summer reading challenge and read 5 books. Choose from the books you have at home or log on to read5.org for a super selection of books you can download for free. Keep track of all the books you've read and submit the tracking sheet online at read5.org or when you return to school. My summer reading challenge ends on September 3rd, 2021. Read 5 or more, you meet the challenge, and you get invited to my big celebration. Stay safe, be good, and read 5.
Welcome back to the Press Box, and we also have joining us today Sage's mother, Dr. Ty Hunt Caesar. I'm so happy to have you here with us, Dr. Hunt, our medical director of the Department of Health, and she actually is linked to Roy Lessensteiner Hospital Medical Center as well. Welcome. We have a question for you, Dr. Hunt. I'm not sure if you're able to hear. Okay. All right. So the question for you is, COVID-19 can be cured naturally. It's a myth. And so I'd like you to be able to help us with this. COVID-19 can be cured naturally with herbal medicine.
Can you hear me?
Yes, I can hear you. Can you hear me? So we're going to try to get Dr. Hunt back. Until we do, we're going to go ahead and continue the questions. It's really the vaccinated people spreading the Delta variant and causing the surge. You hear that? We're actually hearing that quite a bit. Bust that. That's a myth I truly want you to bust, because that is something that is a concern to me.
Yeah, so vaccinated people can still get sick. They're still going to get exposed to COVID. They're just not going to get as sick. And many vaccinated people won't get sick at all. They're not going to be hospitalized, and they're not going to progress to death. So, so far, all of our deaths in the territory, and we've had 41 deaths, were among unvaccinated individuals. And so that is definitely a myth. It is the unvaccinated individuals that's propelling this outbreak to surge in the Virgin Islands right now. So the faster we can get our community to vaccinate so we can get to some level of herd immunity, really need to be above 70%, and we're just under 50% right now of fully vaccinated U.S. Virgin Islanders.
So let's look at the facts, right? The facts is a couple of them. 1, COVID vaccine actually helps, correct? The Delta variant can be contracted by those that have been vaccinated. But what is the percentage? What is the likelihood of that occurring? Is it less than someone who hasn't been vaccinated?
Yeah, you're 4 times less likely to get COVID if you've been vaccinated.
Less likely. Okay, great.
And you're still, 90% less likely to have symptoms or severe symptoms.
And transmitting the virus, if you have been vaccinated, is it less likely that you'll actually have the viral load to be able to transmit it?
It is less likely. If you've been vaccinated, the viral load that you carry is much less than someone who's unvaccinated, and so it's less likely for you to pass it to others.
Those are the facts. Okay, so individuals who are vaccinated are not considered super spreaders.
Correct.
Let's bust that myth, okay? Dr. Shores, I think you needed to say something?
It's interesting if you think about mild cold viruses going around, which coronaviruses are. There are coronaviruses that are cold viruses. If everybody was vaccinated, you would get spread of the virus, just that people wouldn't get so sick. In the United States in July, there were 30,000 deaths from COVID thereabouts, and 100 of them were in people that were vaccinated. So when you think about deaths, I mean, that number, it's not 100%. No vaccine is 100% effective. But if I'm going to put my odds of my life between 30,000 to 100, where are you going to put your money? If I was going to win the lottery based on that, I'd be rich. So you can be rich too by enriching your life and the life of your loved ones by living longer and a more healthy life and getting the vaccine.
So let me go back to those that are hesitant about receiving the vaccine. We respect everyone's opinion, and we respect the fact that you should have the rights. This is your body. Yes, you should have the rights to make decisions for your body. What we're asking those that are hesitant to receiving the vaccine is really and truly, how is it going to impact you, your own body, in years to come if the vaccine actually isn't given to as many people as we need to, and the COVID variant, the variant continues, the virus continues to reproduce, variants continue. How long do you think that COVID-19 will continue if that be the case? So I want those of you out there who are actually considering not to take the vaccine because you feel as though your right is being infringed, to think about what happens to you and your loved one and your family members years to come if we really and truly have to live through many more months and years of a pandemic, and really what that impact is going to be. I really want to go back to Dr. Ellis and what you said. We are one of the lowest or the lowest territory or state in terms of our vaccination rate. And of course, you compare that to the one that actually has the highest rate of acquiring the virus per capita. I think that we need to say that again. Mm-hmm. We are the state and our territory that has the lowest vaccination rate and the highest number of virus that is contracted per day, mm-hmm. per capita.
Right.
They go together. Mm-hmm. And as that occurs, what's happening? It's replicating, it's actually going in. We don't know what's going to come next in terms of what variant is going to be developed. Mm-hmm. We know that there's some lingering in different countries. Yeah. When is it going to come here, and how is it going to impact us? Because we have not gotten to the point where we need to on the vaccine. So I would have wanted Dr. Hunt to tap into some of the other things that we hear within a territory, within the Caribbean islands. We tend to use herbal therapy quite a bit. Is there any herbal therapy that can cure COVID-19?
No.
None of all. So
if there was, we would be using it. Yes. You know, this has been the most intensely studied disease in the history of mankind. The clinical trials, I used to try to read, early on in the pandemic, I tried to read every paper, and it's amazing what the amount of literature that's out there. But I read every single day the new papers that come out. And there have been hundreds and hundreds and hundreds of well-designed clinical trials and thousands of poorly designed clinical trials for all kinds of treatments. And there really have been painfully few. Decadron, which is a cheap drug that's been used for decades, is really the most effective drug that we have for hospitalized COVID patients. People say, oh, Big Pharma is out to make money, that's why you haven't got it. Well, Decadron is not a patented drug. It's been used for centuries. It's cheap. And we showed very early on, the people in England actually showed very early on that it was effective. So if there were any other things that were as effective as Decadron, we would happily take them in. We would happily put them in practice. Show me the clinical trial and I'll use it, whether it be papayas or Decadron.
Oh, thank you for that. Now, one of the things, right, that everyone's studying, like you said, it's one of the most researched vaccine or out there. The COVID virus itself is one of the most researched virus in many, many years, or in its entirety, I think. The Delta is one of the strongest variants that we've seen since pandemics have been around. That's impactful as well. Now, one of the things that individuals say also is, okay, well, Hispanics, Black people, brown people have actually been exposed to government wanting to, let's say, for example, they go back a lot to Tuskegee incident and of course what happened there. And I have to tell you, I'm Hispanic, I'm Black, brown, you could put me all in one. But I have to say that I want those of us from the Caribbean to stop and sit back and think a little bit. The percentage of individuals who are accepting the vaccine are those that are not of Black, Hispanic, Black, and brown. And so, but they are the ones who are surviving, the ones who are taking the vaccine. So I want us to sit down and step back a little bit and think about what's going to happen to us culturally if we don't do what we're supposed to do to help curb and reduce the rights of what's going on in terms of the pandemic. So speak a little bit about what's going on historically, what went on historically, what you guys have been here, you have transformed into a Virgin Islander, you've been here for 2 years, you've been around us for quite some time. What can you say to the general public as to historically what has happened and really and truly what has the FDA, Pfizer, Moderna, and Johnson & Johnson done to ensure that it's a safe vaccine?
Yeah, I guess I can say, you know, nationally and here as well, the majority of people that are unvaccinated are of lower income status and Black and brown. And it is, a lot of it is distrust of the government. But then we're the ones suffering. So I mean, I would just plea with the community to do your own research too and see who has gotten it, what are the long-term side effects, what are your concerns. Reach out to a healthcare provider to talk about it one-on-one if you feel like you want more education. But you know, we have to get to some level of herd immunity to protect our community.
Yeah, and on that note, we're going to take a break and come back. But while we're breaking, general public, community, I want you to sit down and think. We are not here to oppress you or anyone else. We really and truly want your help to get over this hump where we get into community immunity, be able to walk a little free within our own community and survive. See you in a second. Thank you.
Okay, great. Thank you.
Hey, you.
Hey, babe. Thanks for lunch.
You're welcome. Who is that?
That was a representative from the Virgin Islands Department of Health. They're doing a survey called BRF-SS.
Oh, for what?
It's to address chronic diseases facing the Virgin Islands. Diabetes, heart and kidney disease, cancer, stroke, and more.
What kind of questions do they ask?
They ask questions about food, exercise, age, smoking, and some others.
Is that all they ask? Do they ask questions about...
Security? No. They don't ask anything about Social Security, money, or credit card information. The information that they do collect is used to guide public health programs that affect all of us. You, me, the kids, the community, and the entire Virgin Islands.
Oh, okay. Very interesting. I'm glad we could do our part to help.
Yes, we've got to do our part.
For more information, visit our website or call John Orr at 340-643-5422.
Hey students, this is Governor Albert Bryan Jr. One of my favorite things to do is read. A good story can fuel the imagination and introduce you to places and characters you've never seen or heard of before. This summer, I'm reading 5 books, and I'm challenging students in grades K through 6 to do the exact same thing. Take my summer reading challenge and read 5 books. Choose from the books you have at home or log on to read5.org for a super selection of books you can download for free. Keep track of all the books you've read and submit the tracking sheet online at read5.org or when you return to school. My summer reading challenge ends on September 3rd, 2021. Read 5 or more, you meet the challenge, and you get invited to my big celebration. Stay safe, be good, and read 5.
Welcome back. Today we're actually speaking with Dr. Ellis and Dr. Shores in regards to COVID-19 and of course the vaccine and some of the myths that are out there, and trying to really allay the fears of some of the population as to why it's so important to really get the vaccine. One of the other aspects that we've been speaking about is the hospitals and healthcare in general, and some of the fatigue that we know healthcare workers, and you, I'm sure, Dr. Shores, have been exhausted a couple of times. But what are you seeing at the hospitals, and how can you explain the fatigue that we're seeing right now?
Oh, I mean, we've just had more patients than we can handle. I mean, we all know that JFL has structural challenges. We hope to move into our new temporary hospital soon. The current hospital, we just don't have much space. And because of that, the staff is already under a lot of stress. And then when you add it, on an average week 2 years ago, I might have 1 or 2, or heaven forbid, 3 ventilated patients. Now we have 4 ventilated COVID patients, plus other patients that don't have COVID. So it's a huge stress. We've more than doubled our ICU number of patients. We didn't double the number of nurses. We didn't double in the number of CMAs or the people who supply the ICU or physicians. Mm-hmm. And so that makes it hard. It also is hard because it just stretches on, and now we feel like it's such a preventable disease. Every person that we've ever admitted to JFL with COVID has not been vaccinated. We've never admitted a vaccinated patient, and none of our deaths have been in vaccinated patients. So when someone comes in and they say, oh, I'm obese and I have diabetes and I have hypertension and I'm 65 years old, and oh no, I didn't want to get the vaccine, but I'm now really sick. Will you please be up all night and take care of me? Will you please ask the nurses to take an extra patient when they are already really busy? We can't say no, but it hurts our heart.
That's why we call healthcare workers heroes, because they are up 24 hours doing the work that and they do it with a smile, and they do it lovingly. And for that, we cherish our healthcare providers. We cherish you. We cherish the nurses. And for that reason, both ICOs from both of the hospitals have contacted. We've been meeting together for 1.5 years now. You were meeting every single day with the governor in the mornings. We have decreased that the number of times we meet, but we still meet at least 2 to 3 times a week. We communicate in some manner, fashion, practically every day. And so one of the things that the Department of Health has been trying to do is ensuring the number of nurse-to-patient ratio as well as physician-to-patient ratio is actually up. So we actually have been speaking to Pafford, who have been on ground since actually 2017, back and forth, working with our EMS department. We also had a home nurse visiting program out of Pafford, both St. Croix and St. Thomas. We had another company in St. Thomas as well, post-hurricane. So Pafford have actually been on the ground quite some time. So in the effort and not being able to secure staffing from other areas, because everywhere needed staffing, we went into an arrangement with Pafford so that they can actually help us with nursing, in particular EMS, and of course other our entities, respiratory therapists, CNAs, hemodialysis technicians, and registered nurses. So a whole gamut of healthcare workers have actually been provided by Pafford. And so it's not today. We didn't bring them in today. We definitely didn't bring them in because of the vaccine being mandated through the hospitals. We brought them in really and truly to decrease the workload of the staff over time. Now there have been more attrition, and it's because everyone is so exhausted. And not just here in the mainland, you're hearing nurses quit on an ongoing basis because they're exhausted. So you have to have some support, because like you're saying, you have double the amount of patients in the ICU. Dr. Whitley is no longer on the phone with us, but everything starts in the emergency room. And I used to be the chief nursing officer for Wang Lui. I don't know if you're aware of that. But I always said if the ICU is full, the medical surgical units are full, where are the patients? In the emergency room. Because of all the places, you cannot close the emergency room. So it has an impact overall. So the reason why Pafford nurses are on the ground is not to take anyone's position, is really and truly to help to support who's on the ground. And we're willing to do anything that we need to be able to get them up and running. So we're going to take a little break and be right back.
Okay.
Okay, great. Thank you.
Hey, you.
Hey, babe. Thanks for lunch.
You're welcome. Who was that?
That was a representative from the Virgin Islands Department of Health. They're doing a survey called BRFSS.
Oh, for what?
It's to address chronic diseases facing the Virgin Islands. Diabetes, heart and kidney disease, cancer, stroke, and more.
What kind of questions do they ask?
They ask questions about food, exercise, age, smoking, and some others.
Is that all they ask? Do they ask questions about...
Security? No. They don't ask anything about Social Security, money, or credit card information. The information that they do collect is used to guide public health programs that affect all of us. You, me, the kids, the community, and the entire Virgin Islands.
Oh, okay. Very interesting. I'm glad we could do our part to help.
Yes, we've got to do our part.
For more information, visit our website or call John Orr at 340-643-5422.
Welcome back. We have some great questions in the chat I would like to ask to Dr. Ty-Hunt Caesar. One of them is, when will the vaccine be approved for children under 12?
When will the vaccine be approved for children under 12? So right now, the FDA is actually considering that. I know for sure. Dr. Hunt, can you hear us now?
I can hear you. Can you hear me?
Now we can hear you. Go right ahead. Ask the question.
Yes, ma'am. So I'm so sorry for all of the technical difficulties, but definitely the studies are happening very quickly, and I think all of the data is being gathered, and I can't say for certain exactly when the dates will be, or the additional ages under 12 will be approved, but I know that they are working on it to get it definitely approved by the end of this year. So Moderna is working really hard to get the approval, and I know that Pfizer has already submitted it, and that they're just waiting on the FDA to really get all of the data to make sure it's safe and exactly what dose is appropriate for children under the age of 12. So I don't have the exact date, but it could be anywhere as soon as in the next few weeks, but definitely we think that it's going to happen by the end of this year.
Okay, great. I can't wait, because that affects my family, so I'm excited for that opportunity. So another question in the chat is, what are some of the long-term side effects of individuals who have recovered from COVID?
That's an excellent question. I've been seeing, I'm following a lot of patients who we consider and classify as having symptoms of long COVID or the long hauler syndrome. And this is not anything new. We've known that when you recover from viruses, you can have long-term effects. We've seen that with Zika, we've seen that with chikungunya, we've seen that with Lyme's disease. So individuals who are recovering or who have recovered from COVID, we have seen very commonly long-term complications with chronic shortness of breath, chronic fatigue, but most bothersome in the symptoms that we see are the neurological symptoms, meaning that a lot of people have really complained about the brain fog or the inability to concentrate, and that is really what has been most debilitating and bothersome with individuals who have recovered from COVID. But all of the other effects that you can suffer as symptoms of having COVID, which includes cough or shortness of breath, can linger, as well as the loss of taste and smell. That can sometimes linger up to several months. But the long-term effects are still being collected and studied. Some people have had long-term effects even up to a year after recovering from COVID. That's why it's really important for people to prevent getting COVID as much as possible, not just because it can kill you, but because it can really cause chronic problems.
Okay, great. And then one last question from the chat. Can vaccinated individuals, and I know we covered this, but I've seen it a couple times in the chat, can vaccinated individuals spread COVID? To highlight that it's still important for vaccinated individuals to wear your mask and do all the things that all the precautions that we've put out there that help prevent spread.
Sure, I could spend hours on this explanation and trying to really dive in, but to try to make it as succinct as possible, vaccinated individuals can still contract the COVID infection. That is what we have to understand. It doesn't prevent you from actually acquiring the infection, but it prevents you from dying from the infection, and it prevents you from actually having symptoms or severe symptoms. So that means that if you do infect it, you can potentially spread it, but it is so much lower than if you were unvaccinated. And that is what needs to be highly underscored and reiterated to the public. When you are vaccinated, you do transmit the infection at a much less chance and possibility than if you were not vaccinated. And together, we have to remember that the vaccine is not just the end all of be all. We have to remember that mitigation and ending the pandemic is going to be utilizing all the mitigation strategies. So just like what Dr. Alice said, is that we have to continue to wear our masks. We need to continue to socially distance. We need to continue to wash our hands in addition to being vaccinated, because together, once we use all the tools, that is only when we're going to get to a point where we have community immunity, and then we'll be able to stop the mitigation strategies and rely just solely on community immunity. But for now, the vaccinated individuals can transmit the infection at a very, very, very smaller rate than unvaccinated individuals, but you have to continue to wear your mask and do all the other mitigation strategies together.
Thank you so much, Dr. Hans Caesar, for that. Are there any other questions?
That's most of them, most of the big ones.
Okay, good. So one of the things I know we'll try to get Dr. Amaro on as soon as possible as well, but I'm really and truly blessed that you're here but before you go, Dr. Hans, I want you to say something to the general public. I know you actually couldn't come on earlier because you were caring for COVID positive patients. Talk a little bit about what you're doing right now, what you're seeing in St. Thomas.
What we are seeing in St. Thomas is a wide variety of presentations. So we're seeing younger individuals presenting, we're seeing middle-aged individuals presenting, and we're seeing elderly individuals. So it's running the gamut from the pediatric to the elderly population. But the one sort of common feature that we are seeing is that we are seeing admissions and severe presentations all in individuals who have not been vaccinated. And I continue to just be in awe that our statistics in the territory remain at 100% of unvaccinated individuals being in the hospital. Not 99, not 85, but literally 100%. So unfortunately, we're seeing more aggressive disease, people requiring more oxygen on higher rates of oxygen, requiring the ventilator. We've seen the most people on ventilators that we've seen in the territory since the beginning of the pandemic, and it's truly scary. And additionally, what we are seeing is a lot of different presentations of COVID. So not necessarily solely just respiratory illnesses, but a lot of people are coming in with the other GI or abdominal complaints, diarrhea and just pain in the stomach. And a lot of that can be related to a lot of other complications that are happening that we know that can happen with coronavirus that we've seen since the beginning of the pandemic. But we're just seeing it in so much more numbers, and it's truly scary. So that's what we're seeing, just more severe manifestations in the unvaccinated community.
And we, MCH actually has a jingle out there. It says, mommy, daddy, the vaccines are safe. Please go get vaccinated. And really, it's children asking the parents to help, and for us to help them help themselves. Save your own lives. And we're here. And to be honest with you, being the Commissioner of Health is a joy for me. Working with both of you and all the other people in the Department of Health is truly a joy for us. And I think we look at it as not as a chore. It's really a joy to do. But we need your help. We need your help to be able to overcome what we're seeing on a daily basis. We also have Dr. Amaro here with us. Dr. Amaro, thank you for joining us today.
Good evening. Thanks for having me.
Now, it's our pleasure. Dr. Amaro told me that he was actually going to be putting on his nursing scrub last evening. So I know that you are, I know that you're actually working very hard over at RLS. Both Dr. Whitley and Dr. Hunt has been giving us some knowledge of what's happening. We've been speaking also a lot of what's going on with the mandatory vaccines that have been proposed or actually put in place for your clinical staff, not just for nurses, but actually your general population in both hospitals. Tell us a bit of what you're experiencing and how you can actually, or we can help you to encourage your staff to become vaccinated.
Well, as spoken of by Dr. Hunt, the vaccination status or becoming vaccinated is another tool to fighting COVID. Among all the other things that we have been doing, as we get more information on best practices, more information on things that actually work effectively against COVID, we're going to add those tools to the armamentarium of the war against COVID. And so the vaccinations have been so effective, and you heard Dr. Hunt's numbers of basically the only folks coming into the hospital requiring hospitalizations in our ICUs and dying are unvaccinated individuals. We think it is vitally important that we vaccinate our staff, we get them protected so that they can be part of the workforce, but also to protect anyone that comes in needing to be treated. If they're unvaccinated, our patients, we don't want to infect them with staff that are that may be carrying COVID because they're not vaccinated. So this is a very hot topic. In our culture, it's something that's a very personal decision in whether they become vaccinated or not. But we just want to extend that our staff is a very vital part of this fight. They are vital to the organization. They are extremely valiant and heroic members of this fight. And we just want to make sure that they're protected as they also are part of the community. And we have a number of staff that become infected from the community, not from themselves in the hospital. And so we want to make sure that we ensure their safety by having them vaccinated as well.
Thank you. And it's just about that. It's all about being safe. And there have been hospitals that have actually had positive staff that the patients have contracted the COVID-19 from staff. It happened here within the territory. It also happens in the mainland on a constant basis. I know that Dr. Hunt, Dr. Ellis, yourself, and of course your infection disease coordinator, as well as Juan Luis Hospitals, have come together and done so much in terms of educating, re-educating the staff, not just on the COVID and COVID vaccine, but really and truly how to protect themselves from an infection control practice. And I know you've done a tremendous job with that, so congratulations with that. We just now need to make sure that, that we are actually doing what we need to do to encourage the individuals outside to become a little bit more aware. One of the things I say, well, let me just say thank you to each and every one of you for being part of the show today. I think it's very important for us to be able to get the word out, the data-driven, the scientific explanation as to what's going on with the viruses. Going back to the beginning, COVID-19 is a coronavirus. It is a virus. It is a virus that actually lives within our body. It's a virus that actually stays within the human being and replicates when it is given the opportunity to replicate. And it's given the opportunity when there's nothing that is fighting it to replicate. So in other words, the fact that we're not getting vaccinated is allowing the virus to replicate, to become a variant, to become adapted. So in other words, they adapt. You could compare it to, I guess, rats. They live for centuries and they just they adapt to whatever is there. But we have control over this one. We have control, and that control is going back to the vaccination, the correct wearing of a mask under the mouth, over the nose, hand washing, hand sanitizing, and social distancing. There's a lot that we can actually do to help. And of course, I always say, you came, you listened, you were educated. But what we need you to do is now go out into the community and help support our efforts to get rid of the pandemic, educate others to become better students for who we are in terms of our community. We've always been resilient. We'll continue to be resilient. But this is a hard one, and we need your help getting us there. So thank you all for being with us today. And this is going to actually be our conclusion. So actually I'm gonna, if it's okay, Dr. Hunt, can you still hear me? I am actually going to give you the last word. She likes to have the last word, everybody, okay? I'm going to I'm going to give you the last word, Dr. Hunt. What would you like to say to the general public for your last word?
Well, I mean, I don't think that there's much more that I can say that everyone hasn't already covered. I think that it was very important that we discussed all of the current sort of myths that are going around, just so that we can get the truth out. And I really just want our community to wake up and understand that this is not something that we are making up. And this is not something that is not happening to us. We are losing people unnecessarily, and this is the pandemic of the unvaccinated. And the truth is that our vaccination rates are deplorable. They are deplorable within the territory, and we are never going to be able to get back to normalcy. We are not going to be able to have our emergency room available for general illnesses to be treated unless we get our community vaccinated. Yes, there are other ways, there are other methods that we have to do, but if you wait too late to get vaccinated, you're going to end up with COVID. And someone told me that at this point, it's not if you get COVID, it's when you get COVID. So the only way, the best way to protect yourself against that is to get the vaccination. Don't wait another day. Get your questions answered, be comfortable, look at reputable sources, and don't look to social media for the things that are continuously misleading and harmful. So please don't wait any longer. Get vaccinated.
Thank you so much, Dr. Hunt. One of the other things that I'd say is, and one of the nurses, I heard her, waving her flag and saying, go to Jesus and pray. We pray. I pray all the time. And I always ask everyone to pray, because we can't not just do this with man-made items. God is there. Jesus is there. He's been watching over us. He'll continue to watch over us. So prayer is good. But at the same time, you have to make sure that you are being very objective. So put prayer to work and put your knowledge to work. God gave us the strength. He actually put the power, the strength, the knowledge in the individuals, the scientists who have actually developed the COVID vaccine. And so He's there for us. We now need to be here for ourselves and make the right decision so that we can actually combat the virus. Dr. Hunt, Dr. Amaro, Dr. Shores, and of course, Dr. Ellis. Thank you all. Dr. Whitley, I know you left already, but thank you all for being a part of the show today. This was truly splendid. I'm hoping that, like I said, that you've learned a lot, but that you go out and you teach. God bless each and every one of you. Thank you.